Innovation itself is driven by market forces, essentially. That innovators respond to the rewards they see in the marketplace. So if they're able to sell more of a certain kind of therapy or sell it at a higher price, they'll produce more of that therapy. So ultimately, the impact of CER comes down to what it does for the appropriateness of use, the type of use, and the way that innovators get reimbursed for their products. And that's kind of a familiar question, but it also has implications for innovation. And that is to say, what is CER going to do for the way patients use therapy and for the way payers reimburse therapy? So CER is going to have a variety of impacts on the way therapies get used, and some of it's going to be positive and some of it's going to be negative. One example might be that CER studies come out with findings saying, for example, therapy A is often superior to therapy B, or at least superior for a typical or average patient. That's an important finding. Of course, in many contexts, therapy A might not be better for every patient, only for, say, 60 or 70% of the patients. The question is, what happens to all the other patients out there that might prefer the quote-unquote losing therapy? And if CER ends up crowding out all those therapies that aren't best for the average patient but still do good work for a minority of patients, it's going to have a negative impact on innovation by restricting competition, shrinking the number of available choices, and also making it riskier to launch new therapies, because it leads to kind of a winner-take-all mentality, that either your therapy is going to swell to a blockbuster or get completely crowded out, and that risk would tend to discourage a lot of new innovative entrants into the marketplace. I think that CER can certainly be profitably applied to improving the appropriateness of use of therapies for patients. So one example here is if CER can be harnessed and one can clarify some of the diversity in patient outcomes that we see in studies, that will help us match the appropriate patient to the appropriate therapy. So one example here would be, suppose you come back to a study where you find that a certain one therapy A, is better than therapy B, but you also see that outcomes are incredibly diverse among patients in the trial or the study. In a situation like that, it's probably wise to be more cautious about how we translate CER into rigid reimbursement rules, and instead dive more deeply into the data and figure out which patients are actually benefiting from the quote-unquote winner and which patients are doing better with the minority therapy. And that kind of drilling more deeply into the data is particularly important when you have diverse outcomes in a study. So we have to pay attention to the diversity of patient outcomes and also to the disease context that we're operating in. CER is a force for improving the care of patients. There's no question about it. And that it's been much ballyhooed, of course, and maybe people are relying on it to solve all of our problems in healthcare. But CER really has to be deployed correctly. That there are many ways in which CER could be used and abused, and there are other ways in which CER could be properly harnessed to target the right patient to the right therapy. And it's really in the process of targeting patients to therapies that it also encourages the right kind of innovation investments.